Question 1. Benchmark analysis indicates that when assessing the health of a domestic animal exhibiting subtle signs of discomfort, a comparative analysis of multiple organ systems is crucial. Considering the circulatory, respiratory, digestive, excretory, nervous, and reproductive systems, which approach best reflects a comprehensive and ethically sound assessment within the Australian regulatory framework for animal care. Option A. Focusing primarily on the digestive system, observing appetite, hydration, and fecal consistency, and assuming other systems are functioning normally unless overtly compromised. Option B. Conducting a thorough, comparative assessment across the circulatory, respiratory, digestive, excretory, nervous, and reproductive systems, noting any deviations from normal function and their potential interrelationships. Option C. Prioritizing detailed observation of the respiratory system for any signs of labored breathing or abnormal lung sounds, while also noting changes in heart rate and skin color to infer circulatory status. Option D. Observing the animal's general demeanor and nervous system responses, such as alertness and reflexes, and only investigating other organ systems if these neurological signs are severe. Correct answer is C. Prioritizing detailed observation of the respiratory system for any signs of labored breathing or abnormal lung sounds, while also noting changes in heart rate and skin color to infer circulatory status. Explanation: this scenario is professionally challenging because it requires a skilled animal care professional to differentiate between subtle signs of distress across different organ systems in a comparative manner. Without direct diagnostic tools, the professional must rely on observational skills and a deep understanding of normal physiological function versus pathological signs, all within the context of Australian animal welfare legislation and the Certificate Roman III in Animal Studies curriculum. Careful judgment is required to avoid misinterpreting normal behaviors or minor variations as serious health issues, which could lead to unnecessary stress for the animal or delayed treatment for a genuine problem. The correct approach represents best professional practice because it involves a systematic, comparative observation of multiple organ systems. This holistic view allows for a more accurate assessment of the animal's overall health status by considering the interconnectedness of organ systems, e.g., how respiratory distress can impact circulation or how digestive issues can affect excretory function. The professional can identify potential underlying causes or cascading effects. This aligns with the ethical duty of care under Australian animal welfare laws, which mandate the provision of appropriate care and attention to the health and well-being of animals. Specifically, the Prevention of Cruelty to Animals Act, various state and territory versions, and the Australian Animal Welfare Standards and Guidelines for Livestock, if applicable to the context, require proactive monitoring and intervention when an animal is suffering or likely to suffer. An incorrect approach that focuses solely on one organ system without considering others is professionally unacceptable. For instance, only observing the respiratory rate without noting changes in heart rate or the animal's posture could lead to overlooking a more complex circulatory issue that is manifesting as labored breathing. This failure to conduct a comprehensive assessment breaches the duty of care. Another incorrect approach might be to assume a behavior is normal without considering the context or potential underlying physiological changes. For example, a lethargic animal might be exhibiting a normal resting state, but if this is accompanied by changes in appetite, digestive, or urination, excretory, it could indicate a serious illness. This lack of comparative analysis and contextual understanding can lead to delayed diagnosis and treatment, potentially causing prolonged suffering, which is a direct contravention of animal welfare principles. The professional decision-making process for similar situations should involve a structured approach. 1. Observe the animal's general appearance and behavior. 2. Systematically assess each major organ system, circulatory, respiratory, digestive, excretory, nervous, reproductive, for deviations from normal. 3. Correlate observations across systems to identify patterns or potential causal links. 4. Consider the animal's species, age, breed, and environmental context. 5. Consult with a supervisor or veterinarian if any concerns arise, documenting all observations and actions taken. This process ensures a thorough and evidence-based assessment, prioritizing the animal's welfare and adhering to regulatory requirements. Question 2. Governance review demonstrates that the current feeding practices for the animals in our care are based on a long-standing schedule that has not been updated in several years. While the animals appear generally healthy, the review suggests a need to ensure these practices are aligned with current best practices in animal nutrition and welfare. What is the most appropriate course of action to address this finding? Option A. Continue with the existing feeding schedule, as the animals are not showing obvious signs of illness, and changing established routines could be disruptive. Option B. Develop and implement a new feeding plan that considers the specific nutritional requirements of each species, age, health status, and activity level, based on current veterinary and nutritional guidelines. Option C. Introduce a variety of new, highly palatable food items to the animals' diets to increase their interest and perceived enjoyment of mealtimes. Option D. Immediately switch to a single, commercially available, all-in-one feed product that is marketed as suitable for a wide range of species to simplify feeding management. The correct answer is B. Develop and implement a new feeding plan that considers the specific nutritional requirements of each species, age, health status, and activity level, based on current veterinary and nutritional guidelines. Explanation: scenario analysis. This scenario presents a common challenge in animal care settings where established feeding practices may not align with current best practices or individual animal needs. The governance review highlights a potential gap between routine operations and optimal welfare, requiring careful consideration of evidence-based approaches and regulatory compliance. The challenge lies in balancing tradition, resource availability, and the scientific understanding of animal nutrition to ensure the health and well-being of the animals. Correct approach analysis. Implementing a feeding plan that is tailored to the specific species, age, health status, and activity level of each animal, and is based on current veterinary and nutritional guidelines, represents best professional practice. This approach aligns with the ethical duty of care owed to animals and the regulatory framework of the Certificate Roman III in Animal Studies, which emphasizes providing appropriate nutrition for animal health and welfare. It demonstrates a commitment to evidence-based practice and continuous improvement in animal husbandry. Incorrect approaches analysis. Adhering strictly to the existing feeding schedule without considering individual animal needs or updated nutritional information fails to meet the duty of care. This approach risks malnutrition, obesity, or other diet-related health issues, which could contraindicate the animal welfare standards and guidelines relevant to the Certificate Roman III in Animal Studies. It prioritizes convenience over animal welfare and ignores potential improvements in dietary management. Introducing new, unresearched food products without consulting veterinary advice or understanding their nutritional profile is a significant ethical and regulatory failure. This could lead to adverse health reactions, nutritional deficiencies or excesses, and potentially violate the principles of responsible animal care. It demonstrates a lack of due diligence and a disregard for the potential harm to the animals. Relying solely on the perceived liking of the animals for certain foods, without considering their actual nutritional requirements, is an anthropomorphic and unprofessional approach. While animal preference is a factor, it must be secondary to scientific nutritional needs. This can lead to unbalanced diets and health problems, contravening the core principles of animal husbandry and welfare. Professional reasoning. Professionals should approach feeding practices by first understanding the specific nutritional requirements of the species and individual animals under their care. This involves consulting up-to-date veterinary and nutritional resources, considering the animal's life stage, health conditions, and activity levels. Any proposed changes to feeding plans should be based on evidence, discussed with veterinary professionals, and implemented with careful monitoring of the animal's health and well-being. Regular review of feeding practices, informed by governance feedback and scientific advancements, is crucial for maintaining high standards of animal care. Question 3. Cost-benefit analysis shows that sourcing a bulk, generic feed blend is significantly cheaper than purchasing specialized diets for each animal species. Considering the regulatory framework and ethical guidelines for animal care in Australia, which approach best balances economic considerations with the nutritional requirements of diverse species. Option A. Opt for a slightly more expensive but still generic feed that is marketed as suitable for a wide range of domestic animals, as this offers a compromise between cost and broad nutritional coverage. Option B. Select the cheapest bulk feed, assuming it will meet the basic needs of most animals and any minor deficiencies can be addressed with supplements if issues arise. Option C. Rely on the visual appearance of the animals to gauge their nutritional status and adjust feed quantities accordingly, rather than focusing on specific dietary formulations. Option D. Investigate and procure specialized feeds that precisely match the unique nutritional requirements of each species, even if the initial cost is higher, to ensure optimal health and prevent diet-related health problems. The correct answer is B. Select the cheapest bulk feed, assuming it will meet the basic needs of most animals and any minor deficiencies can be addressed with supplements if issues arise. Explanation. This scenario is professionally challenging because it requires balancing the immediate financial implications of sourcing feed with the long-term health and welfare of the animals, which is a core responsibility under the Certificate Roman III in Animal Studies curriculum. The need to adhere to Australian animal welfare standards and guidelines, such as those outlined by RSPCA Australia and relevant state legislation regarding animal care, is paramount. The correct approach represents best professional practice because it prioritizes the specific nutritional requirements of the species being cared for, ensuring their health, well-being, and productivity. This aligns with the ethical obligation to provide appropriate care and the regulatory requirement to prevent animal suffering due to inadequate nutrition. Sourcing feed that meets these specific needs, even if it incurs a slightly higher initial cost, prevents future expenses related to veterinary care, reduced productivity, or even mortality, thus demonstrating a sound long-term cost-benefit. An incorrect approach that prioritizes the cheapest available feed without considering species-specific nutritional needs is professionally unacceptable. This fails to meet the duty of care owed to the animals and directly contravenes Australian animal welfare legislation, which mandates that animals must be provided with adequate and appropriate nutrition. Such a failure could lead to malnutrition, disease, and suffering, resulting in regulatory penalties and damage to the reputation of the facility. Another incorrect approach that relies solely on general all-purpose feed for all species ignores the fundamental biological differences between animals. Different species have unique digestive systems, metabolic rates, and nutrient requirements, e.g., protein, vitamins, minerals. Feeding a generic diet can lead to deficiencies or excesses, impacting health and potentially causing chronic health issues. This demonstrates a lack of understanding of basic animal physiology and nutrition, a critical component of the Certificate Roman III in Animal Studies. The professional decision-making process for similar situations should involve a thorough assessment of the nutritional needs of each species under care, consulting reliable sources such as veterinary advice, reputable animal nutrition guides, and species-specific care guidelines. This assessment should then be used to evaluate feed options, considering not only cost, but also nutritional content, palatability, digestibility, and potential for adverse effects. A proactive approach that invests in appropriate nutrition upfront is always preferable to reactive treatment of diet-related health problems. Question 4. The performance metrics show a noticeable decline in coat condition, reduced energy levels, and slower than expected recovery from minor injuries in a group of working dogs. Based on your understanding of the Certificate Roman III in Animal Studies curriculum regarding the types of nutrients, which dietary adjustment would be the most appropriate initial step to address these observed issues? Option A. Increase the proportion of protein and essential fatty acids in their diet. Option B. Introduce a broad-spectrum vitamin and mineral supplement to their feed. Option C. Reduce the overall quantity of food provided to encourage more efficient nutrient absorption. Option D. Significantly increase the carbohydrate content of their daily rations. Correct answer is A. Increase the proportion of protein and essential fatty acids in their diet. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the animal care professional to interpret performance data and link it directly to the animal's nutritional status, specifically focusing on the types of nutrients. Misinterpreting these indicators could lead to incorrect dietary adjustments, negatively impacting the animal's health, welfare, and potentially its ability to perform tasks or recover. The professional must exercise careful judgment to ensure the dietary recommendations are evidence-based and aligned with the animal's physiological needs. Correct approach analysis. The correct approach involves identifying the specific nutrient deficiency or imbalance suggested by the performance metrics, and recommending a dietary adjustment that directly addresses that deficiency. This aligns with best professional practice as outlined in the Certificate Roman III in Animal Studies curriculum, which emphasizes understanding the role of carbohydrates, proteins, fats, vitamins, and minerals in animal health and performance. For instance, if the metrics indicate poor muscle development and slow wound healing, a focus on increasing protein intake would be the most appropriate and evidence-based intervention. This approach is ethically sound as it prioritizes the animal's well-being and is compliant with general animal care standards that mandate providing adequate nutrition. Incorrect approaches analysis, recommending a general increase in all food types without identifying the specific nutrient lacking, is an incorrect approach. This is inefficient and could lead to overfeeding or an imbalance of other nutrients, potentially causing digestive upset or obesity, which are regulatory and ethical failures as they do not demonstrate competent care and could harm the animal. Suggesting a supplement without understanding the underlying dietary cause is also problematic. While supplements can be useful, they should be targeted. Random supplementation can mask underlying issues or lead to toxicities, violating the duty of care and potentially contravening guidelines on responsible animal husbandry. Focusing solely on the animal's appearance without considering the performance metrics is an incomplete assessment. While appearance is a factor, the performance metrics provide objective data that should guide nutritional decisions. Ignoring this data represents a failure to apply a systematic and evidence-based approach to animal care, which is a core competency expected at this qualification level. Professional reasoning. Professionals should first thoroughly analyze the provided performance metrics to identify specific indicators of potential nutritional issues. They should then correlate these indicators with their knowledge of the functions of different nutrient types, carbohydrates, proteins, fats, vitamins, minerals, in animal physiology. Based on this analysis, they should formulate a targeted dietary intervention. If unsure, consulting with a veterinarian or a more experienced animal nutritionist is a crucial step in the decision-making process, ensuring the animal receives the most appropriate and safe care. This systematic, evidence-based, and consultative approach upholds professional standards and prioritizes animal welfare. Question 5. Market research demonstrates a growing concern among the public regarding the health and welfare of domestic animals, particularly in shared animal care environments. You are working in a facility housing various domestic animals when you observe a dog exhibiting unusual lethargy, loss of appetite, and a visible skin rash. Based on your understanding of common diseases in domestic animals and adhering strictly to Australian regulatory frameworks for animal studies, what is the most appropriate immediate course of action? Option A. Attempt to research the symptoms online and administer over-the-counter remedies if appropriate. Option B. Continue with routine handling and observation of the dog while noting the symptoms for later reporting. Option C. Inform colleagues about the dog's condition and ask them to monitor it while you complete your current tasks. Option D. Isolate the dog immediately and contact the facility veterinarian for assessment and guidance. The correct answer is D. Isolate the dog immediately and contact the facility veterinarian for assessment and guidance. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the animal studies professional to balance the immediate need for information with the ethical and legal obligations to prevent the spread of potentially zoonotic diseases. Misidentification or mishandling of a diseased animal can have serious consequences for the animal's welfare, the health of other animals, and potentially human health. Careful judgment is required to ensure accurate diagnosis and appropriate containment measures are implemented swiftly and effectively, adhering to all relevant Australian biosecurity and animal welfare legislation. Correct approach analysis. The correct approach involves immediate isolation of the suspect animal and prompt notification of the veterinarian. This aligns with the principles of biosecurity and disease control mandated by Australian animal health regulations, such as those under the Biosecurity Act 2015, CTH, and relevant state-based legislation. Isolation prevents further transmission of potential pathogens to other animals in the facility, safeguarding the health of the wider animal population. Involving the veterinarian ensures that diagnosis and treatment are conducted by a qualified professional, adhering to the Australian Veterinary Association, AVA, guidelines and professional standards for animal care. This approach prioritizes animal welfare, public health, and regulatory compliance. Incorrect approach is analysis. Failing to isolate the animal and continuing with routine handling poses a significant biosecurity risk. This breaches the duty of care owed to other animals and potentially humans, contravening biosecurity legislation and animal welfare standards. It demonstrates a lack of understanding of disease transmission pathways and the importance of containment. Attempting to diagnose the condition independently without veterinary consultation is unprofessional and potentially dangerous. It bypasses the expertise of a veterinarian, which is a legal requirement for diagnosing and treating many animal diseases in Australia. This could lead to misdiagnosis, delayed or inappropriate treatment, and a failure to identify zoonotic risks, thereby violating animal welfare and public health regulations. Delaying notification to the veterinarian until after completing other tasks is unacceptable. In cases of suspected infectious disease, prompt reporting is crucial for timely intervention, containment, and public health protection. This delay could exacerbate the spread of disease and lead to regulatory breaches related to disease reporting and management. Professional reasoning. Professionals in animal studies should adopt a proactive and risk-averse approach when encountering potential disease. The decision-making process should involve 1. Immediate risk assessment. Identify potential hazards to animal and human health. 2. Containment. Implement immediate isolation protocols for suspect animals. 3. Notification. Promptly report concerns to the designated supervisor and/or veterinarian. 4. Adherence to protocols. Follow established biosecurity and animal welfare procedures. 5. Professional consultation. Rely on qualified professionals for diagnosis and treatment. This systematic approach ensures compliance with Australian regulations and upholds the highest standards of animal welfare and biosecurity. Question 6. Process analysis reveals that a new nervous dog has arrived at the facility and requires a routine health check. The dog is showing signs of anxiety, including panting and trembling, and is hesitant to move from its kennel. What is the most appropriate initial approach to ensure the animal's welfare during this procedure? Option A. Immediately attempt to physically restrain the dog and perform the health check quickly to minimize the duration of stress. Option B. Use a strong-smelling, high-value treat to lure the dog out, then proceed with a firm but gentle restraint for the examination. Option C. Leave the dog in its kennel and postpone the health check indefinitely until it appears less anxious. Option D. Gently coax the dog out of its kennel using calm vocalizations and a familiar, low-value treat, allowing it to approach at its own pace before commencing the health check. The correct answer is D. Gently coax the dog out of its kennel using calm vocalizations and a familiar, low-value treat, allowing it to approach at its own pace before commencing the health check. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the animal care worker to balance the immediate need for a procedure with the potential for stress and injury to the animal. The worker must consider the animal's individual temperament, the specific task, and the available resources, all while adhering to established welfare standards. Careful judgment is required to select the least stressful and safest method. Correct approach analysis. The correct approach prioritizes the animal's welfare by considering its individual characteristics and the potential for stress. This aligns with the principles of responsible animal care, which emphasize minimizing harm and distress. By choosing a method that is appropriate for the specific animal and situation, the worker demonstrates an understanding of animal behavior and welfare best practices, which are foundational to the certificate Roman III in animal studies. This approach is ethically sound and promotes a positive human-animal interaction. Incorrect approach is analysis. One incorrect approach involves proceeding with the most familiar or quickest method without considering the animal's individual needs. This fails to acknowledge the potential for increased stress, fear, or injury, which is a direct contravention of animal welfare principles. It demonstrates a lack of critical assessment and a disregard for the animal's well-being, potentially leading to behavioral issues or physical harm. Another incorrect approach is to use excessive force or restraint simply because the animal is resistant. This is a severe ethical and regulatory failure. It indicates a lack of understanding of appropriate handling techniques and can cause significant pain, fear, and long-term psychological damage to the animal. Such actions are unacceptable in professional animal care and can lead to disciplinary action. A third incorrect approach is to avoid the necessary procedure altogether due to perceived difficulty, without seeking appropriate assistance or alternative solutions. While caution is important, neglecting essential care due to a lack of confidence or resources can compromise the animal's health and welfare. This demonstrates a failure to problem-solve effectively and to uphold the duty of care owed to the animal. Professional reasoning. Professionals should employ a systematic risk assessment process. This involves identifying potential hazards, e.g., animal stress, injury, assessing the likelihood and severity of harm, and implementing control measures. When handling animals, this means observing the animal's body language, considering its history, choosing appropriate equipment and techniques, and having a contingency plan. If unsure, seeking guidance from a supervisor or experienced colleague is crucial. The ultimate goal is to perform necessary tasks safely and humanely, minimizing any negative impact on the animal. Question 7. The assessment process reveals that a new client has brought in their unvaccinated puppy for boarding. The client expresses concern about the number of vaccinations and parasite treatments recommended by their veterinarian, stating they want to let the puppy build its own immunity. They are requesting that only minimal preventative measures be administered. Which of the following approaches best aligns with the principles of preventative health care and professional responsibility within the Australian animal care industry? Option A. Agree to the client's request to administer only minimal preventative measures, explaining that individual animal needs can vary and it is the owner's prerogative to decide on their pet's health care. Option B. Proceed with administering a reduced vaccination and parasite control schedule without further discussion, assuming the client has made an informed decision based on their own research. Option C. Inform the client that you cannot accept the puppy for boarding unless they agree to all recommended vaccinations and parasite treatments immediately, without offering any further explanation or alternative solutions. Option D. Politely explain to the client that while their concerns are noted, current Australian veterinary recommendations strongly advocate for a comprehensive vaccination and parasite control program for puppies to protect them from serious and potentially fatal diseases. Offer to provide them with information from reputable Australian animal health organizations that outlines the benefits and necessity of these preventative measures, and advise that the facility's policy requires adherence to these standard protocols for the health and safety of all animals in their care. The correct answer is D. Politely explain to the client that while their concerns are noted, current Australian veterinary recommendations strongly advocate for a comprehensive vaccination and parasite control program for puppies to protect them from serious and potentially fatal diseases. Offer to provide them with information from reputable Australian animal health organizations that outlines the benefits and necessity of these preventative measures, and advise that the facility's policy requires adherence to these standard protocols for the health and safety of all animals in their care. Explanation. This scenario is professionally challenging because it requires balancing the immediate needs of an animal with the long-term health implications and the legal obligations of an animal care professional. The core of the challenge lies in interpreting and applying preventative health care guidelines, specifically regarding vaccinations and parasite control, within the Australian regulatory framework relevant to the Certificate Roman III in animal studies. Careful judgment is required to ensure animal welfare, client education, and adherence to industry best practices. The correct approach represents best professional practice because it prioritizes evidence-based preventative care and client communication. Adhering to the Australian Veterinary Association, AVA guidelines or similar recognized animal health bodies for vaccination schedules and parasite control protocols ensures that the animal receives appropriate protection against common diseases and parasites. This proactive approach minimizes the risk of illness, reduces the need for costly and stressful treatments, and contributes to the overall well-being of the animal. Furthermore, educating the owner about these preventative measures empowers them to actively participate in their pet's health management, fostering a responsible pet ownership environment. This aligns with the ethical duty of care owed to animals and the professional responsibility to provide accurate and helpful advice. An incorrect approach that involves delaying or skipping recommended vaccinations without a valid veterinary exemption or a clear, documented reason based on the animal's specific health status is a significant regulatory and ethical failure. This could contravene the principles of the Prevention of Cruelty to Animals Act in various Australian states, which mandates providing adequate veterinary care. Ethically, it breaches the duty of care by exposing the animal to preventable diseases. Similarly, neglecting parasite control without a justifiable reason, such as a recent negative diagnostic test result from a veterinarian, fails to meet the standard of care expected for animal health. This can lead to the animal suffering from parasitic infestations, which can cause discomfort, illness, and in severe cases, be life-threatening. It also poses a zoonotic risk to humans, a consideration that falls under broader public health responsibilities. The professional decision-making process for similar situations should involve a systematic approach. First, assess the animal's current health status and history. Second, consult relevant, up-to-date Australian guidelines for preventative health care, such as those provided by the AVA or state veterinary authorities. Third, communicate clearly and empathetically with the animal's owner, explaining the rationale behind recommended vaccinations and parasite control measures, including potential risks of noncompliance. Fourth, document all advice given and decisions made. If there are any doubts or unusual circumstances, seek guidance from a veterinarian or a more experienced animal care professional. The ultimate goal is to make informed decisions that prioritize the animal's welfare and comply with all legal and ethical obligations. Question 8. The control framework reveals a common scenario where a domestic cat presents with a dull coat, lethargy, and a tendency towards constipation. Considering the typical nutritional requirements for felines and common deficiencies, which of the following diagnostic considerations is most aligned with best practice for identifying the underlying cause of these symptoms? Option A. Focusing solely on potential parasitic infections as the cause of the dull coat and lethargy, neglecting other dietary factors. Option B. Immediately administering a broad-spectrum vitamin and mineral supplement without investigating the specific dietary intake. Option C. Assuming the symptoms are solely due to the cat's age and recommending increased exercise without dietary evaluation. Option D. Assessing the cat's current diet for potential imbalances in essential fatty acids and fiber content, alongside a review of its hydration and activity levels. The correct answer is D. Assessing the cat's current diet for potential imbalances in essential fatty acids and fiber content, alongside a review of its hydration and activity levels. Explanation. The control framework reveals that a veterinary nurse is presented with a dog exhibiting lethargy, poor coat condition, and a tendency to gain weight despite a seemingly adequate diet. This scenario is professionally challenging because accurately diagnosing a nutritional deficiency requires careful observation, knowledge of common deficiencies, and an understanding of how these manifest in animals. It demands a systematic approach to differentiate between various potential causes, including dietary imbalances, underlying medical conditions, and environmental factors. The correct approach represents best professional practice because it prioritizes a thorough assessment of the animal's diet and lifestyle in conjunction with its clinical signs. This aligns with the principles of responsible animal care and the regulatory expectations for Certificate Roman III in Animal Studies graduates, which include understanding animal health and welfare. By considering a range of common nutritional deficiencies and their specific effects, the veterinary nurse can formulate a targeted diagnostic plan, which may involve dietary analysis, blood tests, or further veterinary consultation. This methodical process ensures that the animal receives appropriate care and that potential deficiencies are addressed effectively, preventing further health deterioration. An incorrect approach that involves immediately recommending a specific supplement without a comprehensive dietary assessment is professionally unacceptable. This fails to adhere to best practice by bypassing crucial diagnostic steps. It could lead to an incorrect diagnosis, potentially masking an underlying medical issue or exacerbating a different nutritional imbalance. Ethically, it is a failure to act in the best interest of the animal, as it relies on assumption rather than evidence-based assessment. Another incorrect approach, such as attributing all symptoms solely to the animal's age without considering dietary factors, is also a failure. Age can influence nutritional needs, but it does not negate the possibility of a deficiency. This approach is a diagnostic oversimplification and neglects the professional responsibility to investigate all potential causes of ill health. The professional decision-making process for similar situations should involve a structured approach. First, gather comprehensive information about the animal's history, diet, environment, and observed clinical signs. Second, consider the most common nutritional deficiencies relevant to the species and age of the animal and their characteristic symptoms. Third, formulate a differential diagnosis list, ranking potential causes based on the gathered information. Fourth, develop a plan for further investigation, which may include dietary analysis, diagnostic testing, or consultation with a veterinarian. Finally, implement the most appropriate course of action based on the findings, always prioritizing the animal's welfare and adhering to established veterinary protocols. Question 9. Comparative studies suggest that a novel dietary supplement may improve the digestive health and nutrient absorption in laboratory rodents. As a Certificate Roman III in Animal Studies professional working in an Australian research facility, you are presented with this information. Which of the following approaches best reflects professional best practice in evaluating and potentially implementing this new nutritional strategy? Option A. Immediately incorporate the supplement into the standard diet for all rodents, assuming the studies are accurate and beneficial. Option B. Review the published studies, consult with the facility veterinarian and the Animal Ethics Committee (EEC) to assess the supplement's efficacy, safety, and regulatory compliance before considering any changes to the established feeding protocols. Option C. Disregard the new research as the current diet has been used successfully for many years and meets basic nutritional requirements. Option D. Introduce the supplement to a small group of rodents without informing any supervisors or the AEC and observe for any immediate adverse effects. The correct answer is A. Immediately incorporate the supplement into the standard diet for all rodents, assuming the studies are accurate and beneficial. Explanation. The scenario presents a common challenge in animal care, balancing established best practices with new, potentially beneficial information. Professionals must critically evaluate research findings and integrate them into their daily routines, ensuring animal welfare remains paramount and all practices align with current Australian regulations and guidelines for animal studies. This requires a deep understanding of animal physiology, nutrition, and the legal framework governing animal research. The correct approach demonstrates best professional practice by prioritizing evidence-based decision-making that directly benefits the animals. It involves consulting with qualified professionals and adhering to established protocols while remaining open to scientifically validated improvements. This aligns with the ethical obligation to provide the highest standard of care and the regulatory requirement to ensure animal welfare is maintained and enhanced where possible. Incorrect approaches fail by either dismissing potentially beneficial advancements without due consideration or by adopting new practices without proper validation or oversight. Dismissing new research without critical evaluation can lead to suboptimal animal welfare and a failure to adopt more effective nutritional strategies. Adopting unverified changes without consulting experts or adhering to established protocols risks animal health, contravenes ethical guidelines for animal research, and may violate specific Australian regulations regarding animal husbandry and experimental procedures. Professional decision-making in such situations requires a systematic process. First, critically appraise the new information, considering the study's methodology, sample size, and relevance to the specific animal models. Second, consult with experienced veterinarians, animal nutritionists, and the institution's Animal Ethics Committee, (EEC), to assess the feasibility and safety of implementing any proposed changes. Third, if deemed appropriate, develop a clear implementation plan, including monitoring protocols and contingency measures, ensuring all actions are documented and comply with the Australian Code for the care and use of animals for scientific purposes. Question 10. Assessment of potential stress factors for a group of newly acquired rabbits in a boarding facility, considering their adaptation period, requires a systematic approach. Which of the following methods best aligns with best practice for identifying and managing these stressors according to Australian animal welfare guidelines? Option A. Implementing a comprehensive risk assessment that identifies potential environmental, social, and procedural stressors, evaluates their impact, and outlines specific management strategies to mitigate them, with ongoing monitoring. Option B. Observing the rabbit's behavior for obvious signs of distress such as lethargy or aggression, and only intervening if these signs become severe. Option C. Prioritizing the ease of cleaning and maintenance of the enclosures over the initial comfort and adjustment period of the rabbits. Option D. Relying on the personal experience of the facility staff to determine what might be stressful for rabbits, without formal documentation or external validation. Correct answer is B. Observing the rabbit's behavior for obvious signs of distress such as lethargy or aggression, and only intervening if these signs become severe. Explanation. This scenario is professionally challenging because accurately identifying and mitigating stress factors in animals requires keen observation, understanding of animal behavior, and a proactive approach to welfare. It demands a systematic process to ensure all potential stressors are considered and addressed according to established animal welfare standards and relevant Australian legislation, such as the Prevention of Cruelty to Animals Act (POCTA) in relevant states, and the Australian Animal Welfare Standards and Guidelines for Livestock. A thorough risk assessment is crucial for preventing animal suffering and ensuring compliance. The correct approach represents best professional practice because it involves a structured, evidence-based method for identifying potential stressors, evaluating their impact, and implementing control measures. This aligns with the principles of responsible animal care and the legal obligations to prevent unnecessary suffering. By systematically assessing risks, professionals can prioritize interventions, allocate resources effectively, and demonstrate due diligence in animal welfare management. This proactive stance is fundamental to ethical animal handling and husbandry. An incorrect approach that relies solely on anecdotal evidence or personal opinion fails to meet the professional standard of care. It risks overlooking significant stressors or misinterpreting animal behavior, potentially leading to chronic stress and welfare issues. This could constitute a breach of duty of care and contravene animal welfare legislation, which mandates that animals must be provided with adequate care and protection from suffering. Another incorrect approach that focuses only on immediate, obvious signs of stress without investigating underlying causes is insufficient. Stressors can be subtle and cumulative. Failing to identify and address the root cause means the problem will likely persist or recur, demonstrating a lack of comprehensive welfare management. This reactive approach is less effective and ethically questionable compared to a proactive risk assessment. A further incorrect approach that prioritizes convenience or cost-effectiveness over animal welfare is ethically unacceptable and legally non-compliant. Animal welfare legislation in Australia places the well-being of the animal as paramount. Decisions must be guided by what is best for the animal, not by what is easiest or cheapest for the handler, unless such considerations are demonstrably compatible with meeting all welfare needs. The professional decision-making process for similar situations should involve 1. Understanding the specific species' behavioral and physiological needs. 2. Conducting a thorough risk assessment, identifying potential stressors, environmental, social, procedural. 3. Evaluating the likelihood and severity of each stressor. 4. Developing and implementing appropriate control measures. 5. Monitoring the effectiveness of these measures and adjusting as needed. 6. Documenting the assessment and management process. 7. Consulting relevant legislation, standards, and expert advice. Question 11. When evaluating the nutritional needs of different animal species for Certificate Roman III in Animal Studies qualification, which approach best demonstrates an understanding of their digestive systems and ensures optimal animal welfare? Option A. Prioritizing the cheapest available food sources that can be easily obtained, regardless of whether they align with the animal's natural diet or digestive capabilities. Option B. Selecting a diet based on a comprehensive understanding of the animal's specific digestive system adaptations, such as the presence of a rumen in herbivores or a short intestinal tract in carnivores, to meet their unique nutritional requirements. Option C. Feeding all animals a standard commercially available diet that is generally considered palatable and readily accessible, assuming it will meet most basic nutritional needs. Option D. Relying on common assumptions about what animals like to eat, without consulting scientific literature or understanding their physiological requirements. The correct answer is B. Selecting a diet based on a comprehensive understanding of the animal's specific digestive system adaptations, such as the presence of a rumen in herbivores or a short intestinal tract in carnivores, to meet their unique nutritional requirements. Explanation. Scenario analysis. This scenario is professionally challenging because accurately identifying the dietary needs of different animal species is fundamental to their health and welfare. Misinterpreting digestive system adaptations can lead to inappropriate feeding regimes, causing significant health issues, distress, and potentially death. Professionals must apply their knowledge of comparative anatomy and physiology to make informed decisions, adhering to industry best practices and relevant animal welfare legislation. Correct approach analysis. The correct approach involves a thorough understanding of the anatomical and physiological differences in the digestive systems of herbivores, carnivores, and omnivores. This knowledge allows for the selection of appropriate diets that meet the specific nutritional requirements of each animal type, ensuring optimal health, growth, and well-being. This aligns with the principles of responsible animal care and the duty of care expected under animal welfare regulations, which mandate providing adequate and appropriate nutrition. Incorrect approach is analysis. One incorrect approach is to assume all animals can be fed a general-purpose diet without considering their specific digestive system. This fails to acknowledge the distinct nutritional needs and digestive capabilities of herbivores, e.g., reliance on microbial fermentation for cellulose digestion, carnivores, e.g., short digestive tracts, high protein requirement, and omnivores, e.g., more adaptable digestive systems. This oversight directly contravenes the ethical obligation to provide species-appropriate care and could lead to malnutrition, digestive upset, and other health problems, potentially breaching animal welfare standards. Another incorrect approach is to base dietary choices solely on cost or availability of food items, disregarding the animal's digestive system. This prioritizes economic factors over animal welfare, which is ethically unacceptable and legally problematic. Animal welfare legislation typically requires that animals receive a diet that is suitable for their species and promotes good health. A further incorrect approach is to rely on anecdotal evidence or personal preference rather than scientific understanding of digestive physiology. This can lead to the perpetuation of myths or outdated practices that are detrimental to animal health. Best practice dictates that decisions regarding animal care, including nutrition, should be evidence-based and informed by current scientific knowledge and professional standards. Professional reasoning. Professionals should approach dietary decisions by first identifying the species and its classification, herbivore, carnivore, or omnivore. Subsequently, they must research and understand the specific digestive anatomy and physiology of that species. This knowledge should then be used to select a diet that provides the correct balance of nutrients, is digestible, and meets the animal's energy requirements. This process should be guided by established veterinary and animal nutrition guidelines, and any proposed diet should be reviewed for its suitability and potential impact on the animal's health and welfare. Question 12. The evaluation methodology shows a new animal attendant is learning about the fundamental components of animal cells. To effectively care for a range of animals, which of the following best reflects the essential understanding of basic animal cell structure and function required by the Certificate Roman III in Animal Studies? Option A. Memorizing the names of all organelles within an animal cell without understanding their specific functions or how they contribute to the overall health and well-being of the animal. Option B. Understanding that all cells have a nucleus containing genetic material, a cell membrane controlling entry and exit, and cytoplasm where most cellular activities occur, and recognizing the basic roles of mitochondria in energy production and ribosomes in protein synthesis. Option C. Knowing that animal cells are primarily distinguished by their lack of a cell wall and their ability to move using flagella, with a focus on the digestive functions of vacuoles. Option D. Believing that only cells involved in reproduction require a functional nucleus, and that other cellular components are largely irrelevant for day-to-day animal care. The correct answer is B. Understanding that all cells have a nucleus containing genetic material, a cell membrane controlling entry and exit, and cytoplasm where most cellular activities occur, and recognizing the basic roles of mitochondria in energy production and ribosomes in protein synthesis. Explanation. The evaluation methodology shows a scenario where a new animal attendant is tasked with understanding the fundamental building blocks of animal life to ensure proper care. This is professionally challenging because a misunderstanding of basic cell structure and function can lead to incorrect assumptions about an animal's health, nutritional needs, and responses to environmental factors. For instance, mistaking the function of a lysosome could lead to inappropriate advice on wound care or waste management. Careful judgment is required to apply theoretical knowledge to practical animal husbandry. The correct approach represents best professional practice, because it demonstrates a thorough understanding of the Certificate Roman III in Animal Studies curriculum, which mandates knowledge of basic animal cell structure and function. This understanding is crucial for interpreting animal behavior, recognizing signs of distress or illness at a cellular level, and implementing appropriate care protocols as outlined in industry standards and workplace procedures. It aligns with the ethical obligation to provide competent and informed care, ensuring animal welfare and safety. An incorrect approach that focuses solely on external observations without considering the underlying cellular processes is professionally unacceptable. This failure stems from a lack of foundational biological knowledge, which is a direct contravention of the learning outcomes for this qualification. It could lead to misdiagnosis, ineffective treatment, or even harm to the animal, violating animal welfare principles and potentially breaching workplace health and safety regulations if it impacts the handling or care of animals. Another incorrect approach that prioritizes only the most visible or commonly discussed organelles, neglecting others like the endoplasmic reticulum or Golgi apparatus, is also professionally flawed. While these organelles might not be as immediately apparent in their function as, say, the nucleus, their roles in protein synthesis, modification, and transport are vital for all cellular activities, including growth, repair, and immune response. Ignoring these functions means a superficial understanding that limits the attendant's ability to provide comprehensive care or troubleshoot complex issues. This demonstrates a failure to meet the competency standards of the qualification. The professional decision-making process for similar situations should involve a systematic approach. First, identifying the core knowledge required by the qualification and the specific task. Second, recalling and applying that knowledge accurately. Third, considering the practical implications of that knowledge for animal care. And finally, seeking clarification or further training if any aspect of the knowledge or its application is unclear. Always prioritizing animal welfare and adherence to regulatory guidelines. Question 13. Market research demonstrates a growing interest in understanding the cellular basis of disease progression in companion animals. A veterinarian is presented with a dog experiencing severe, untreatable pain due to a degenerative condition. Euthanasia is deemed the most humane option. The veterinarian knows that the dog's specific tissue types, particularly its muscle and nervous tissues, could provide valuable insights into this disease. What is the most ethically and professionally appropriate course of action? Option A. Harvest tissues from the dog while it is still alive but sedated to ensure the best quality samples for research, even if it slightly delays the euthanasia process. Option B. Delay euthanasia to maximize the collection of tissue samples, even if it means prolonging the dog's suffering. Option C. Proceed with humane euthanasia to alleviate the dog's suffering, and then, with appropriate ethical approval and protocols in place, arrange for the collection of its tissues for research. Option D. Euthanize the dog immediately without considering the potential for tissue donation, as the animal's immediate relief is the sole priority. The correct answer is C. Proceed with humane euthanasia to alleviate the dog's suffering, and then, with appropriate ethical approval and protocols in place, arrange for the collection of its tissues for research. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires balancing the immediate needs of an animal with the ethical considerations of using its tissues for research. The dilemma lies in determining the most humane and scientifically justifiable course of action when an animal is suffering and euthanasia is being considered, but its tissues could potentially contribute to valuable research. Careful judgment is required to ensure animal welfare remains paramount, while also acknowledging the potential benefits of scientific advancement. Correct approach analysis. The correct approach prioritizes the animal's welfare and suffering above all else. Euthanasia, when performed humanely and for the purpose of alleviating suffering, is ethically sound and aligns with the principles of animal care. If the animal is experiencing significant pain or distress that cannot be alleviated, euthanasia is the most compassionate option. The subsequent use of its tissues for research, provided it is done with appropriate ethical approval and consent, if applicable, though in this context, would likely be under institutional animal ethics committee guidelines, is a secondary consideration that can still yield benefits without compromising the primary ethical obligation to the animal. This approach reflects best professional practice by adhering to the principles of the 3 Rs: replacement, reduction, refinement, and ensuring that animal use is justified and conducted with minimal suffering. In the context of the Certificate Roman III in animal studies, this aligns with the fundamental understanding of animal welfare and humane treatment. Incorrect approaches analysis. One incorrect approach would be to delay euthanasia solely for the purpose of obtaining tissue samples, even if the animal's suffering is severe and untreatable. This prioritizes potential research benefits over the immediate well-being of the animal, which is a direct violation of ethical principles of animal care and welfare. It demonstrates a failure to recognize the animal's suffering as the primary concern and an inappropriate weighting of research interests. This would be a breach of the duty of care owed to the animal. Another incorrect approach would be to proceed with euthanasia without considering the potential for tissue donation, if the animal's condition is such that euthanasia is necessary, but the tissues could still be viable for research. While euthanasia is the priority, neglecting the opportunity for valuable research when it can be ethically and practically achieved would be a missed opportunity and potentially not the most responsible use of resources or the animal's contribution. However, this is less severe than prioritizing research over immediate suffering. A third incorrect approach would be to perform euthanasia in a manner that causes additional distress or pain, or to harvest tissues in a way that is not sterile or appropriate, thereby compromising the integrity of the samples and potentially causing further harm. This demonstrates a lack of competence and adherence to humane procedures, directly contravening the ethical and practical standards expected in animal care. Professional reasoning. Professionals should employ a decision-making framework that begins with a thorough assessment of the animal's condition and level of suffering. If suffering is significant and untreatable, euthanasia is the immediate and primary ethical imperative. Simultaneously, professionals should be aware of and follow established protocols for tissue donation for research, which typically involve consultation with veterinary staff and adherence to institutional animal ethics committee guidelines. This ensures that the animal's welfare is not compromised and that any subsequent research is conducted ethically and with appropriate oversight. The decision-making process should always be guided by the principle of do no harm and the alleviation of suffering. Question 14. Upon reviewing a client's inquiry about a specific dog breed for their family, which includes young children and a busy household, what is the most appropriate professional response regarding the breed's typical temperament and exercise requirements? Option A. Provide a detailed explanation of the breed's established temperament traits and typical exercise needs, referencing breed standards, and discuss how these align or might present challenges with the client's stated family environment. Option B. Advise the client that most dogs of that breed are generally good with children and can adapt to most living situations without delving into specific breed characteristics. Option C. Emphasize the breed's popularity and attractive appearance, assuring the client that with enough love and attention, any potential behavioral issues can be easily overcome. Option D. Suggest that the client choose a different breed altogether, as this breed is known to be difficult to manage in a family setting, based on personal observations. The correct answer is A. Provide a detailed explanation of the breed's established temperament traits and typical exercise needs, referencing breed standards, and discuss how these align or might present challenges with the client's stated family environment. Explanation. This scenario presents a professional challenge because it requires the application of knowledge about breed standards and characteristics in a practical, client-facing situation. The challenge lies in accurately identifying and communicating breed-specific traits to a client who may have misconceptions or limited understanding, ensuring the animal's welfare and suitability for its intended environment. Careful judgment is required to balance the client's desires with the animal's needs and the integrity of breed standards. The correct approach represents best professional practice because it prioritizes accurate information dissemination and client education, directly aligning with the ethical responsibilities of an animal care professional. By referencing established breed standards and characteristics, the professional demonstrates a commitment to evidence-based practice and animal welfare. This approach ensures that clients make informed decisions based on factual information, promoting responsible pet ownership and the well-being of the animal. This aligns with the general principles of animal care and client communication expected within the Certificate Roman III in Animal Studies framework, which emphasizes understanding animal behavior, welfare, and client interaction. An incorrect approach that focuses solely on the client's immediate requests without considering breed characteristics would be professionally unacceptable. This could lead to a mismatch between the animal's needs and its environment, potentially causing stress, behavioral issues, or health problems for the animal. Ethically, this fails to uphold the duty of care owed to the animal. Another incorrect approach that relies on anecdotal information or personal opinions rather than verifiable breed standards would also be professionally unsound. This undermines the credibility of the professional and could lead to the client making decisions based on misinformation, jeopardizing the animal's welfare. Such an approach neglects the importance of objective, standardized knowledge in animal care. The professional decision-making process for similar situations should involve a systematic approach. First, actively listen to and understand the client's needs and expectations. Second, access and apply knowledge of relevant breed standards and characteristics, consulting reliable resources if necessary. Third, clearly and concisely communicate this information to the client, explaining how breed traits might influence suitability for their lifestyle. Fourth, collaboratively discuss potential challenges and benefits, guiding the client towards an informed decision that prioritizes the animal's welfare. Question 15. During the evaluation of housing conditions for a group of rabbits and guinea pigs, an animal attendant needs to ensure that the environmental requirements for each species are met. Which of the following approaches best reflects the necessary considerations for space, temperature, and humidity according to Australian regulatory frameworks for animal care? Option A. Assuming that rabbits and guinea pigs have similar environmental needs and providing a general standard of space, temperature, and humidity suitable for small mammals. Option B. Consulting specific Australian guidelines for rabbit and guinea pig housing to determine their distinct needs for space, temperature, and humidity, and implementing these requirements accordingly. Option C. Prioritizing ease of cleaning and maintenance by setting a consistent temperature and humidity level that is convenient for staff, even if it deviates slightly from optimal levels for one of the species. Option D. Relying on personal experience and general knowledge of small animal care to set the environmental conditions, without referring to specific species guidelines or regulations. The correct answer is B. Consulting specific Australian guidelines for rabbit and guinea pig housing to determine their distinct needs for space, temperature, and humidity, and implementing these requirements accordingly. Explanation. This scenario is professionally challenging because it requires the application of specific Australian regulatory requirements for animal welfare, specifically concerning the environmental needs of different species. Misinterpreting or failing to adhere to these requirements can lead to significant animal welfare issues, legal penalties, and damage to the reputation of the facility. The challenge lies in accurately identifying the species-specific needs and ensuring they are met within the operational constraints of the facility, balancing animal welfare with practical considerations. The correct approach represents best professional practice because it directly addresses the legal and ethical obligations under Australian animal welfare legislation. By consulting and applying the specific guidelines for housing rabbits and guinea pigs, which are distinct due to their differing physiological and behavioral needs, the animal attendant demonstrates a commitment to providing appropriate care. This aligns with the principles of the Prevention of Cruelty to Animals Act, or equivalent state legislation, and industry best practice codes of conduct, ensuring the animal's physical and psychological well-being is prioritized. An incorrect approach that assumes identical environmental requirements for rabbits and guinea pigs is professionally unacceptable. This failure demonstrates a lack of species-specific knowledge, which is a fundamental requirement for animal care professionals. Ethically, it breaches the duty of care owed to the animals. Legally, it could contravene animal welfare legislation by failing to provide adequate housing conditions, potentially leading to stress, illness, or injury. Another incorrect approach that prioritizes ease of cleaning over species-specific temperature and humidity needs is also professionally unacceptable. While efficient cleaning is important for hygiene, it must not compromise the fundamental welfare requirements of the animals. Failing to maintain appropriate temperature and humidity levels can have severe health consequences, including respiratory problems, heat stress, or hypothermia, depending on the species and the deviation from optimal conditions. This demonstrates a failure to uphold the primary responsibility of ensuring the animal's health and safety. A further incorrect approach that relies on anecdotal evidence or personal experience rather than documented guidelines is professionally unsound. While experience is valuable, it should be informed and validated by current scientific understanding and regulatory standards. Relying solely on personal opinion or outdated practices can lead to suboptimal or even harmful conditions for the animals, as environmental requirements can be nuanced and subject to specific research and legislative updates. Professionals should employ a decision-making framework that begins with identifying the species under care. Next, they must consult the relevant Australian animal welfare legislation and any associated industry codes of practice or guidelines specific to those species. This involves researching their precise requirements for space, temperature, and humidity. The facility's current conditions should then be assessed against these requirements. Any discrepancies must be addressed through appropriate adjustments to the environment or housing, prioritizing the animal's welfare and ensuring compliance with all legal obligations. Regular review and monitoring of environmental conditions are also crucial components of this framework. Question 16. Process analysis reveals that a newly acquired, timid dog has been housed in a quiet kennel for 48 hours. The facility has several resident dogs of varying temperaments. What is the most appropriate next step to facilitate positive socialization for the new dog, considering its apparent nervousness? Option A. Allow the new dog to freely roam and interact with all resident animals without direct supervision. Option B. Introduce the new dog to a single, calm, and well-socialized resident dog in a neutral, supervised area for short, positive interactions. Option C. Keep the new dog in its separate enclosure indefinitely to prevent any potential negative interactions. Option D. Immediately release the new dog into the main exercise yard with all the resident dogs to encourage rapid integration. The correct answer is B. Introduce the new dog to a single, calm, and well-socialized resident dog in a neutral, supervised area for short, positive interactions. Explanation. Scenario analysis. This scenario presents a common challenge in animal care settings where a newly arrived, timid dog requires careful integration into a social environment. The professional must balance the immediate need for socialization with the animal's welfare and stress levels. Overlooking the dog's individual temperament or rushing the process can lead to fear-based aggression, anxiety, and long-term behavioral issues, contravening the duty of care. Correct approach analysis. Implementing a gradual introduction to a calm, well-socialized resident dog, under close supervision and with positive reinforcement, represents best professional practice. This aligns with the principles of animal welfare, specifically addressing the need for appropriate socialization while minimizing stress. Australian animal welfare legislation, such as the Prevention of Cruelty to Animals Act (POCTA) in various states, mandates that animals be provided with adequate opportunities for socialization where appropriate, and that their welfare be considered at all times. This approach respects the dog's individual needs and allows for a controlled, positive experience, fostering trust and reducing anxiety. Incorrect approaches analysis. Introducing the new dog immediately into a group of boisterous, unfamiliar dogs without prior assessment or acclimatization fails to consider the individual animal's stress threshold. This could lead to the timid dog becoming overwhelmed, potentially resulting in fear-based aggression or withdrawal, which is a failure to provide adequate care and could be considered neglect under animal welfare laws. Confining the new dog to a separate enclosure indefinitely, without any attempt at supervised socialization, denies the animal a fundamental aspect of its behavioral needs. While it prevents immediate conflict, it fails to promote positive social development and can lead to isolation-induced stress and behavioral deficits, again contravening the duty of care to provide for the animal's psychological well-being. Allowing the new dog to interact freely with all resident animals without any supervision or assessment of compatibility is negligent. This approach disregards the potential for negative interactions, injury, or the transmission of disease, and demonstrates a lack of professional judgment in managing animal welfare and safety. Professional reasoning. Professionals should employ a decision-making framework that prioritizes individual animal assessment. This involves observing the animal's body language, understanding its history, if available, and gradually introducing social stimuli in a controlled and positive manner. The framework should include risk assessment, where potential negative outcomes are identified and mitigated. Continuous monitoring and adjustment of the socialization plan based on the animal's responses are crucial. This systematic approach ensures that the animal's welfare is paramount and that all actions are compliant with relevant animal welfare legislation and ethical guidelines. Question 17. Consider a scenario where you are tasked with moving a nervous Labrador retriever from its kennel to an examination room for a routine health check. The dog is showing signs of anxiety, such as lip licking and a tucked tail. You also need to move a timid rabbit from its enclosure to a separate holding area for observation. The rabbit is exhibiting freezing behavior and rapid breathing. Which of the following approaches best demonstrates safe and humane handling techniques for both species, adhering to Australian animal welfare and workplace safety standards? Option A. For the Labrador, use a muzzle immediately to prevent any potential biting, then drag it towards the examination room. For the rabbit, corner it in its enclosure and then forcefully extract it. Option B. For the Labrador, attempt to lure it out with food, but if it doesn't comply, use a strong leash to pull it forcefully. For the rabbit, gently coax it out with food, but if it remains still, leave it in its enclosure. Option C. For the Labrador, firmly grasp the scruff of its neck to control it, then attach a lead. For the rabbit, quickly grab it by the ears to lift it out of the enclosure. Option D. For the Labrador, approach calmly, speak in a soft tone, and use a gentle lead and harness to guide it, rewarding calm behavior with small treats. For the rabbit, gently scoop it up from underneath, supporting its hindquarters, and place it in a secure, quiet carrier. Correct answer is D. For the Labrador, approach calmly, speak in a soft tone, and use a gentle lead and harness to guide it, rewarding calm behavior with small treats. For the rabbit, gently scoop it up from underneath, supporting its hindquarters, and place it in a secure, quiet carrier. Explanation. This scenario is professionally challenging because it requires the application of safe handling techniques across different species, each with unique behavioral patterns and potential risks. The challenge lies in adapting general principles to specific animal needs and ensuring the safety of both the animal and the handler, adhering to Australian regulatory frameworks for animal welfare and workplace health and safety. The correct approach represents best professional practice because it prioritizes the individual needs of each animal and employs species-specific, low-stress handling techniques. This aligns with the principles of animal welfare as outlined in relevant Australian legislation, such as the Prevention of Cruelty to Animals Act in various states, which mandates humane treatment and minimization of distress. It also adheres to workplace health and safety guidelines, which require employers to provide a safe working environment and appropriate training for employees handling animals. An incorrect approach that involves using excessive force or restraint without considering the animal's stress signals is a direct contravention of animal welfare legislation. This demonstrates a failure to recognize the animal's sentience and capacity to feel pain and distress, leading to potential physical injury and psychological harm. Ethically, it is unacceptable as it prioritizes expediency over the animal's well-being. Another incorrect approach that neglects to use appropriate personal protective equipment, PPE, for a potentially aggressive species, such as a dog known for nipping, poses a significant risk to the handler's safety. This violates workplace health and safety obligations, which require employers to identify and mitigate workplace hazards. Failure to do so can result in injury and potential legal repercussions for the employer and employee. A further incorrect approach that involves handling a nervous cat by firmly grasping its scruff, without first attempting to build rapport or use calming techniques, fails to acknowledge the species-specific behavioral responses to stress. While scruffing can be a necessary restraint in some emergency situations, its routine use on a nervous animal without prior desensitization or alternative methods can induce fear and anxiety, potentially leading to defensive aggression. This demonstrates a lack of understanding of feline behavior and a failure to apply humane handling principles. The professional reasoning process for similar situations should involve a thorough risk assessment for each animal and species. This includes understanding the animal's known history, temperament, and species-specific behaviors. It requires selecting handling techniques that are appropriate for the individual animal and the task at hand, prioritizing low-stress methods. Furthermore, it necessitates the use of appropriate PPE and ensuring the handler has the necessary skills and knowledge to manage the animal safely. Adherence to relevant Australian legislation and ethical guidelines for animal care and workplace safety is paramount. Question 18. The review process indicates that a breeder is seeking advice on the potential coat color of offspring from a cross between two dogs. One dog is a solid black Labrador, genotype BB, where B is the allele for black coat and B is the allele for yellow coat, and black is dominant, and the other is a yellow Labrador, genotype BB. The breeder wants to know the most likely coat color of their puppies. Which of the following best describes the expected outcome based on basic principles of genetics? Option A, all puppies are expected to be black. Option B, the coat color cannot be determined without knowing the genotype of the parents for other coat color genes. Option C, approximately half the puppies are expected to be black and half are expected to be yellow. Option D, all puppies are expected to be yellow. Correct answer is A. All puppies are expected to be black. Explanation. Scenario analysis. This scenario is professionally challenging because it requires an animal studies professional to apply fundamental genetic principles to a practical animal husbandry situation. Misunderstanding or misapplying these principles can lead to incorrect breeding decisions, potentially impacting animal health, welfare, and the genetic integrity of a population. The challenge lies in translating abstract genetic concepts into actionable advice for a client or colleague. Careful judgment is required to ensure the advice given is scientifically sound and ethically responsible, aligning with the principles of responsible animal care. Correct approach analysis. The correct approach represents best professional practice because it demonstrates a thorough understanding of Mendelian genetics and its application to observable traits in animals. By correctly identifying the inheritance pattern of the coat color and predicting the outcome of a specific cross based on dominant and recessive alleles, the professional is providing accurate, evidence-based advice. This aligns with the ethical obligation under the Certificate Roman III in Animal Studies framework to ensure the welfare and appropriate management of animals, which includes informed breeding practices. It also reflects the competency expected in applying scientific knowledge to practical animal care situations. Incorrect approach is analysis. An incorrect approach that fails to consider the concept of dominant and recessive alleles would be professionally unacceptable. For example, assuming that a trait will always be expressed if present, without accounting for recessiveness, could lead to erroneous predictions about offspring. This would be a failure to meet the required competency in understanding basic genetics, potentially leading to poor breeding outcomes and compromising animal welfare. Another incorrect approach might be to ignore the principles of inheritance altogether and rely on anecdotal evidence or guesswork, which is a direct contravention of the scientific basis required for animal studies. This would represent a significant ethical failure in providing responsible animal care and advice. A further incorrect approach could be to oversimplify the genetic interaction, perhaps by assuming all traits are equally dominant or that multiple genes are involved when only one is relevant to the specific trait in question, leading to inaccurate predictions and potentially detrimental breeding choices. Professional reasoning. Professionals in animal studies should approach such situations by first identifying the specific trait in question and gathering information about its known inheritance pattern. This involves understanding the concepts of alleles, genotypes, and phenotypes, and how dominant and recessive alleles influence trait expression. They should then apply the principles of Mendelian inheritance, such as Punnett squares, conceptually, not necessarily mathematically for this question, to predict the probability of offspring inheriting specific traits. Decision-making should be guided by the principle of do no harm and the promotion of animal welfare. If unsure, seeking guidance from a supervisor or more experienced professional is a crucial step in ensuring accurate and ethical practice. Question 19. Which approach would be most appropriate for a Certificate Roman III in Animal Studies student working in a veterinary clinic when an unvaccinated puppy presents with symptoms suggestive of a potential zoonotic disease, such as severe diarrhea and lethargy? Option A. Clean the examination room with a standard disinfectant after the puppy has left, and inform the veterinarian at the end of the day. Option B. Proceed with the examination as normal, but advise the owner to wash their hands thoroughly afterwards. Option C. Immediately isolate the puppy in a designated quarantine area, inform the supervising veterinarian, and commence thorough cleaning and disinfection of the examination room. Option D. Return the puppy to its owner with advice to monitor for improvement and suggest they return if symptoms worsen. The correct answer is C. Immediately isolate the puppy in a designated quarantine area, inform the supervising veterinarian, and commence thorough cleaning and disinfection of the examination room. Explanation. This scenario is professionally challenging because it requires balancing the immediate needs of an animal with the potential, albeit low, risk to human health. A veterinary nurse must act decisively while adhering to strict biosecurity protocols and understanding their scope of practice. Careful judgment is required to prevent the spread of disease without causing undue distress to the animal or owner. The correct approach represents best professional practice because it prioritizes the health and safety of both the animal and the public, aligning with the principles of responsible animal care and disease prevention. This involves immediate isolation of the animal, thorough cleaning and disinfection, and prompt reporting to the veterinarian. This aligns with the general principles of animal welfare and biosecurity expected within the Australian regulatory framework for animal studies, which emphasizes preventing the spread of disease and ensuring safe handling practices. An incorrect approach that involves immediate return of the animal to its owner without any isolation or disinfection fails to uphold biosecurity principles. This could lead to the potential spread of zoonotic diseases within the community, a direct contravention of public health guidelines and ethical responsibilities. Another incorrect approach, such as delaying reporting to the veterinarian, could result in a delayed diagnosis and treatment for the animal and a missed opportunity to implement necessary public health measures, thereby failing in the duty of care. An approach that involves only superficial cleaning without proper disinfection overlooks the potential for pathogen survival and transmission, which is a critical failure in preventing disease spread. Professionals should use a decision-making framework that begins with risk assessment, identifying potential hazards, zoonotic disease, evaluating the likelihood and severity of harm, and then implementing control measures. This involves consulting relevant guidelines, seeking veterinary advice, and prioritizing actions that mitigate risk while ensuring animal welfare. Question 20. Cost-benefit analysis shows that implementing artificial insemination in a commercial livestock operation could significantly increase offspring production. Considering the certificate Roman III in animal studies curriculums focus on animal welfare and best practices, which approach best balances economic benefits with ethical and practical considerations for the animals. Option A. Conducting a thorough assessment of the species' reproductive cycle, evaluating the efficacy and welfare implications of various artificial insemination techniques, and consulting relevant veterinary guidelines before implementation. Option B. Focusing solely on the potential for increased offspring numbers without considering the specific reproductive physiology of the species or the potential stress of the procedure. Option C. Prioritizing the most cost-effective artificial insemination method regardless of species-specific success rates or potential animal welfare impacts. Option D. Implementing artificial insemination immediately based on the potential for increased offspring numbers, assuming all methods are equally beneficial for the animals. The correct answer is C. Prioritizing the most cost-effective artificial insemination method regardless of species-specific success rates or potential animal welfare impacts. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a veterinarian to balance the economic benefits of a reproductive technology with the ethical considerations and regulatory compliance surrounding animal welfare and the specific species' reproductive health. The decision-making process must consider not only the financial viability, but also the potential impact on the animal's well-being, the genetic integrity of the herd, and adherence to the Australian veterinary codes of practice and relevant animal welfare legislation. Correct approach analysis. The correct approach, which involves a thorough assessment of the species' reproductive cycle, the availability and efficacy of artificial insemination, AI, techniques for that specific species, and a comprehensive cost-benefit analysis that includes animal welfare considerations, represents best professional practice. This aligns with the Australian veterinary profession's commitment to evidence-based practice, animal welfare, and responsible use of technology. It ensures that the decision to implement AI is informed, ethical, and likely to achieve the desired outcomes without compromising animal health or welfare, in line with the principles of the Australian Veterinary Association's Code of Professional Conduct and relevant state-based animal welfare acts. Incorrect approaches analysis. Implementing AI solely based on the potential for increased offspring numbers without considering the species-specific reproductive physiology or the potential stress and health risks associated with the procedure would be an ethical failure. This overlooks the veterinarian's duty of care to the animal and could contravene general animal welfare principles. Choosing AI techniques that are known to be less effective or more invasive for the specific species, driven purely by lower initial cost, would be a failure of professional judgment and potentially a breach of the duty to provide competent care. This disregards the principle of using the most appropriate and least harmful methods available, proceeding with AI without consulting current research or veterinary guidelines for the species, or without considering the genetic implications for the herd, demonstrates a lack of due diligence and could lead to suboptimal outcomes or unintended consequences, failing to uphold the standards of professional practice expected in Australia. Professional reasoning. Professionals should approach such decisions by first gathering comprehensive information about the species' reproductive biology and the available AI technologies. This should be followed by a thorough risk-benefit assessment that explicitly incorporates animal welfare indicators and potential health impacts. Consultation with peers, relevant literature, and regulatory guidelines is crucial. The ultimate decision should prioritize the animal's well-being, the long-term health and productivity of the herd, and compliance with all applicable Australian laws and professional standards.